We'll check on our phones.
Mm-hmm.
Facebook. Our house.
I got it.
Yippee. Okay. Cool. So we are live.
I love it. All right, so we're gonna love it, and then
Share some things. Start a watch party.
right, exactly. But I don't know. All right, how do I share it from here? Can I? Oh, I gotta go back to the.
Yeah.
No, not that way. There we go. To share it down there. Share, write a post, but not that as my newsfeed. There we go.
Beautiful. My phone's just not loading at all.
Getting started. Post. Post. There we go. All right.
I'm going to set this down until my phone decides
Got
to
it.
load.
All right. Well, good evening, everyone. Welcome to Get Well Family Chiropractic and our Tuesday night Facebook Live class. I am Dr. Robin Lawrence.
I am Dr. Sarah Plonica.
And we are so excited that you are joining us tonight. We know you have lots of other things that you could be doing, and we are really so glad that you have chosen to join us tonight. And we really can't wait to share with you how beneficial chiropractic care is for kids.
Yeah.
You know,
Absolutely.
I've got 5 kids, right? They've all been adjusted since the day they were born. We had all 5 of them at home, and that was a really great experience. If any of you have questions or comments or concerns about home birth, I'm more than happy to have a discussion with you. So make sure you put that down in your comments. And as we go through the class tonight, if you have any questions or comments or experiences that you think everyone would really enjoy, put them down in the comments as well. We've got our phones open, so we'll be able to see them right away, and we'll address them as best we can. As always, later on, we'll be sharing references if you guys want them. And please share this with your friends and family or in the groups that you might belong to. If you belong to a mom's group or a homeschool group or your church group, we really are, we've taken a stand of being a beacon of light and hope for this community in the current crisis that we're in. And even if there weren't a current crisis, right, we would still be a beacon of light and hope. We are here for those newly awakened seekers, right?
Yep.
And people seeking truth in alternative ways, and, just are sick and tired of being sick and tired, and they're tired of their kids being sick and tired.
Yep.
Right? So start a watch party, share, the more the merrier. Let's get started.
Absolutely. Let's go. All right, I'm going to make us a little bit bigger.
I like it. I like being big, especially with my new hair.
Yeah, check it out.
Whoop, whoop, whoop.
Okay. So. Yep. All right.
Here we go.
All right, so chiropractors have been actually caring for children for over 100 years now. Many childhood ailments will respond to this safe, natural form of healthcare that we practice. Parents who are already chiropractic patients often seek chiropractic care for their children. And here at our office, we have a lot of families that are our patients, and they come in all together and get adjusted and treated regularly.
Yeah, it's a lot of fun. We got one family with 8 kids that come in.
Yep, when they're coming. They come running down the hall.
It's awesome. I love it.
So chiropractors combine drug-free holistic care with spinal adjustments to create a healthy child approach. And while chiropractic is based on the important relationship between the spine and the nervous system, it also endorses and provides a non-drug and non-invasive holistic care for your child. So one of the most basic ideas in chiropractic is that dysfunction in our spine and its joints can lead to dysfunction within the nervous system. And since the nervous system controls and coordinates all of the systems in our body, everything, spinal dysfunction can have wide-ranging effects on the body's health. and we as chiropractors are trained to evaluate and adjust this spinal dysfunction.
Yep.
Children may display signs of favoring head turning to one side or the other, and determining imbalances or asymmetry with the muscular function or the joint alignment can be addressed early with this. So we also address the link between the central nervous system and various childhood afflictions. So children may have symptoms like ear infections, difficulty breathing, colic, or attention deficit, and all of these can be addressed by chiropractors. So we view these symptoms as expressions of the body not interpreting the world properly. And we will question here, is something wrong going on with the nervous system, maybe? And what is it, if it is? And can chiropractic care help here? So let's just look a little bit closer here at chiropractic care for children.
So the physical growing years for our children are often accompanied by many traumas and stress, right? In fact, during development in the uterus, before the baby's even born, the fetal position can cause a spinal misalignment, and then as the baby is then pushed down through the birth canal, right, it can get jammed up, a shoulder may be stuck on a pubic bone. I know one of my sons did that, and can make, the trip down the birth canal, even worse. Newborn health conditions like colic, reflux, breastfeeding difficulties, maybe can't latch on one side but does fine on the other, sleep disturbances, allergic reactions, things like eczema and psoriasis or, just sinusy type things. Chronic infections, ear infections can all often be traced back to the nervous system irritation caused by these spinal and cranial misalignments, right? And, thankfully, we've been trained, right, to really care for, evaluate, and correct all of these things. Toddlers and children have frequent falls, right? They're learning how to walk, boom. Learning how to walk, boom, right? They have sports injuries. They have playground bumps, right? How many of them have spun off that spinning device? I don't even know what it's called. They carry such heavy school bags. I know picking up my kids' bags is just awful. And then, of course, they sit all day in their classroom, right? And they probably sit kind of like I am right now, slouched over, slumped over. It really is a combination of things that really stresses a growing child's spine and nerve system. So, let's really take a look at how we care for a child holistically.
So when you first get to the chiropractor's office,
our office,
yep, we will conduct a history of your child's health together while discussing your observations and complaints that you might have about what's going on with your kiddos.
And if the child is of, talking age, they may be able to tell us some information as well.
Yep. So then we would perform a physical exam of your child's spine and their whole body. We're trained to evaluate pediatric spinal problems gently, which puts your child at ease. So chiropractic child care specialists specifically have specific skills to find and adjust any involved spinal areas with specific gentle adjustments, which are appropriate to the infant and the child's spine and cranium. Spinal adjustments for infants and young children often involve a very light fingertip pressure to correct these spinal misalignments. And the amount of force that we use is often not much more than just a finger touch and is usually sufficient to get that movement back into the spinal joints that might have become locked up and are causing that interference to the normal nervous system function. So the International Chiropractic Pediatric Association, or the ICPA, links chiropractic to the very moment that a child emerges from the womb, as birth can be a very traumatic event, like we said before.
Great big head, little bitty hole.
Yep. And like we just alluded to there.
Yeah.
It can cause physical damage that can lead to difficulties later with development. So if a baby develops breathing trouble, the real cause might simply be just a misalignment to the spine or somewhere else in their body from the birth process.
Right.
And a popping sound can occur occasionally when the spinal joints are moved, but this is not always heard when children's spines are adjusted.
Typically because we don't adjust them that way.
Mm-hmm.
Yeah.
Yep. And other techniques involve the use of handheld instruments, which we use a lot here at our office. And those are going to offer very specific but gentle corrections that are not painful to the child. That's the last thing we would want.
Oh, right. Absolutely.
And there's just really a broad array of childhood illnesses and injuries that we address at the chiropractic office in a holistic, non-drug way. Some of these are going to be addressed with spinal adjustments and some without.
Right.
All right. Moving along.
Absolutely. So one of the things I also want to address is the word holistic, right? Because I think there are sometimes confusion about what holistic care means. You know, and in our office, what it really means is that we're looking at mind, body, spirit, right? We're looking at how can we remove interference and irritation to the nerve system with adjusting, and then is there any type of environmental irritation that we can recommend removing from the environment of the child. And then also we look at nutrition, right? Is there anything that we need to add nutrition-wise, whether it be a food or a supplement, to help support the body in healing itself? So chiropractic care for children, it really is painless, right? Like I mentioned, we had all 5 of our kids at home. They've all been checked and adjusted since 15 minutes after they were born. And it's a gentle finger pressure. While possibly a painful injury, right, is maybe what brought them in, the child may be sensitive to the touch. So, you got a bruise, it kind of hurts to touch. You pulled a muscle, it kind of hurts to touch. The joint's swollen, it might be, a little tender. But generally, children appreciate our hands-on approach, and they really enjoy every visit. And quite often, just a few adjustments restores normal function. There was a study recently done by the ICPA in the United States, Canada, and Europe, and it really showed that only a few children out of more than 10,000 visits experienced minor discomfort and fussiness at the chiropractic office visit. So the remaining children in the study had absolutely no adverse reactions to their adjustments. And this preliminary data really tells us that chiropractic care for children may be one of the safest forms of health care available. And many parents have their children checked regularly, right? Like we mentioned earlier, we have several families that come in either weekly or bi-weekly to have the entire family checked, just as part of a regular healthy lifestyle, right? To help them develop to their full potential. Chiropractic care is safe, it's gentle, it's effective. It is the only way to address the dysfunction of the nerve system and to promote overall wellness in the newborn and the growing child. Right? Did you know that the baby's spine lengthens, right, by 50% in the first year? I mean, that is huge. Crazy. And it's the very first thing to develop, right? We've got a brain and we've got a spinal cord. It's the very first thing to develop in the womb. Everything else comes off of that. And at no other time does this growth happen so rapidly. So we want to make sure that we take care of those babies in a proper alignment, ensuring proper symmetrical growth.
Very well put.
Oh, thanks. There's more. Haha. So the Hutter-Volkmann law states that bones change shape with pressure. By slowing bone growth in response to pressure, compression forces, any spinal misalignment changes the balance of pressure across the spinal bones and can lead to asymmetric bone development. Right? We actually have a patient who is in his 30s, and he started care with us earlier this year with severe back pain. We had x-rays done, and he has several, we call them hemivertebrae. So because of the misalignment of pressure, the vertebrae grew crooked, and it created a scoliosis. We need our spine. Where's our spine? There he is.
Got it here.
He's got it. I love it. So in the first year of life, right, there are curvatures that we want the spine to develop, right? So the neck curve, which is going to be a C, right? And then the low back curve, which is also a C, or called a lordosis, we want it to curve that way. The middle back, the thoracic spine, is a backward C. That one is called a kyphosis. And it's critical that these curves develop in the first year of life as the baby's starting to crawl, roll over, and sit. That's when these curvatures really start to develop. And their purpose is for movement, balance, upright posture, protection, and shock absorption.
And the sacrum down here.
Oh, and the sacrum too. That's
also
right.
a kyphosis.
It is also a kyphosis. Thank you for reminding me of that.
Of course.
You know, as we've been hinting, chiropractic care really aims at optimization of the nerve system. The central nervous system consists, of the brain and the spinal cord, and it processes everything that your body does. Movement, heartbeat, smiles from that baby, right? And which makes us smile, right? Feeling that sun on your skin, laughing, smelling those wonderful things that are cooking in the kitchen or flowers in the garden, our creativity, right? It is all coordinated by the brain and the spinal cord. And in infants, the central nervous system also controls their growth and development. Infancy is the time of greatest brain and proprioceptor development. Now, proprioceptor is a big word. They are our position sensors in our body, right? We've got lots of them in our ankles and in our feet and, you know, as babies and crawling in their hands and wrists. So, you know, really infancy is the time to ensure that they have a healthy nerve system.
All right, let's talk a little bit about colic here. I know. Terrible. So colic is frequent, prolonged, and intense crying or fussiness in a healthy infant. Colic can be particularly frustrating for parents because the baby's distress occurs for no apparent reason, and no amount of consoling seems to bring these babies any relief.
None.
So these episodes often occur in the evenings when the parents themselves are often tired, and that can just make it even more frustrating.
Yes, for sure.
So episodes of colic usually peak when an infant is about 6 weeks old and can decline significantly after 3 to 4 months of age. And the excessive crying will resolve with time, but managing colic adds significant stress to caring for your newborn child. Yeah. So that's no fun.
No.
So features of colic could include some of the following. It's going to be intense crying that may seem more like screaming or an expression of pain. Crying for no apparent reason, unlike crying to express hunger or the need for a diaper change. Extreme fussiness, even after the crying has diminished. Predictable timing, so the episodes are normally occurring in the evening. Let's just start. And then facial discoloring, such as reddening of the face or a paler skin around the mouth. And then bodily tension. So there's going to be pulled up or stiffened legs, stiffened arms, clenched fists, an arched back, or a tense abdomen.
Yeah. So
colic is really common. I'm sure you guys have heard about it at least. And it occurs with equal frequency in the following groups. So it's equal in males and females. It's equal in breast and bottle-fed infants, full-term and preterm infants. And then it's equal in the first or the second child in a family and other siblings too. So colic is stressful for parents, like we said. Research has shown an association between colic and the following problems with parent well-being. Increased risk of postpartum depression in mothers, early cessation of breastfeeding, feelings of guilt, exhaustion, helplessness, or anger. Yeah. So 2 major studies on colic. So 2 major studies on colic have shown that over a period of 2 weeks, which is usually 3 visits, 34%, I hope that says 34. My notes are blocked by something. So 34, I believe, percent of babies adjusted by chiropractors showed a
I think it's 84.
84. Okay.
When I was reading that study and putting that note in,
Actually,
I believe it says
it might be 94.
It might be.
94% of babies adjusted by
We'll
chiropractors.
post the resource.
Yeah. Showed a successful rating, with 25% showing improvement after the very first adjustment.
Mm-hmm.
Dr. S. Vallone, in a 2007 study, concluded that chiropractic adjustments in the early stages of neurological imprinting appear to safely and effectively address the craniocervical dysfunction and help to restore natural, efficient suckling patterns for infants who are unable to successfully latch.
Right, and just to define craniocervical, right? So your head, where it meets your neck.
Yeah.
All right. He's a superhero. I love it. That is awesome. So, chiropractic care begins with babies, right? We talk about cradle to grave care. It provides support and care through adulthood, as well as promoting overall health and well-being. So chiropractic processes make a child healthier. They're more active, and they're generally happier, right, during their growth, as eliminating the major stressors of the nervous system can improve physical health as well as mental concentration. Chiropractic care provides some of the following benefits, and we've seen this in our office. I've been in practice 24 years. I've seen it, right? It promotes healthy brain and nerve development. The baby's nerve system, like we said, controls everything: breathing, digestion, thinking, sense of touch, their ability to play. So any damage or disruption can really seriously impair, the baby's ability to function in the best way. Assists with asthma, allergies, other breathing difficulties. One of my first pediatric cases was a girl with asthma, and within like 3 adjustments, she didn't need her inhaler anymore. So it also can assist with good spinal posture, right? Since chiropractic focuses on adjustments of the spine, it'll help improve the child's spinal posture. And this structure is, it's the way the body is built, right? Mm-hmm. So it's important to begin good posture habits early. And then, we said birth was really traumatic, right? And then all those little bumps and falls on their bums while they're trying to learn how to walk, falls off bicycles, all those, things can add up to improper posture later on. And one of the really cool things is seeing kids with behavioral problems. When, they're having trouble staying still in school, or they're having trouble listening at home. Now, we don't treat the behavioral problems, right? But what we do is we eliminate the major stressors in the nervous system with adjustments. And by in removing those spinal subluxations, those irritations to the nervous system, the child is more calm, right? They're more at peace, and they're able to process their external world internally a whole lot better. And we see these kids become happier, better, higher functioning. And on top of that, they sleep better, right? And if there's any type of bedwetting issues, they can be resolved as well, right? Tension in the neck and back, headaches, joint pain can all disrupt sleep, right? And making sure that the spine is aligned and everything's moving can help your body's child relax and sleep. I don't know how many mamas have said, "Oh my gosh, my baby slept through the whole night. Thank you. I am so refreshed," right? The other thing that chiropractic adjustments do, right? We talked about the word subluxation earlier, right? In chiropractic, we call those spinal misalignments a subluxation or a vertebral subluxation that disturbs the proper function. And, when we're talking about bedwetting, we're talking about a reflex that's called the phrenic reflex. And when we adjust specific levels of the spine, lumbar spine, sacral spine, we can influence that phrenic reflex and decrease the bedwetting instances. And the earlier we get those children in, the quicker they resolve. Although I have had, some kids that are 8, 9, 10, 12 years old that are still having issues, and we have combined holistic therapies along with adjusting to help these kids. Assists with digestion, right? If there's subluxation in the middle back, all those nerves that go to digestion can start working better. Now we have less spitting up. Also, when we look at the tailbone, the sacral parasympathetic nerves and those fibers, sympathetic nerves are our fight or flight nerves. There are stress nerves. And by just putting things back into alignment, we bring the body out of that fight or flight, stress, defense physiology, and into a more relaxed state, which allows digestive processes to really kick in. And what do we want more now than ever is highly functioning immune systems, right? We're getting ready to send our kids back to school. Some of us are. And we want healthy, strong immune systems so that they can, mentally be well, because they're, in school and they're learning, and we don't want them to have to miss school. There's tons of nerves that influence the immune system that we're going to talk about in a little bit later, right? We've already talked about colic, and irritable baby syndrome.
All right, so let's jump into the immune system a little bit here. So a recent analysis of scientific literature indicates that there are numerous modes of communication between the nervous system and the immune system, as we know this. It also occurs not only just in theory, but in practice, that chiropractic adjustments have a beneficial effect on the functioning of both the nervous and the immune system. For many years, chiropractors have exclaimed that spinal adjustments can help improve the overall health of the individual, and now there's really this growing body of scientific research to support that. So let's get into the role of the chiropractic adjustment and the immune system. The nervous system dysfunction that we're seeing can cause immune system dysfunction, and chiropractic theory postulates
we got big words today.
That by removing the nervous system interference with spinal adjustments, this can correct immune system dysfunction as well. And this is because poor movement in the spine can adversely affect the immune response by causing the body to incorrectly activate a stress response. And those extra stress responses in the body are going to slow the ability of the immune system to react. There is also a significant decrease in antibiotic therapy use among children receiving chiropractic care, which we love.
We love that.
A Penn State University study of 654 Americans published in the Journal of Social Science and Medicine stated that people with childhood health problems were twice as likely to develop cancer or chronic lung disease by late middle age. Arthritis was about 33% higher in this group, and a childhood of ill health may lead to a full gamut of adult illnesses. So that's just what we're trying to address here tonight.
Right, exactly. Right? Let's avoid all of that.
Healthy kids.
Right, growing up to be healthy adults.
So we believe that chiropractic stimulates the immune system to combat infectious processes, and it not only helps sick people get well, but it also helps healthy people become even healthier. The nervous system and the immune system have just such a multitude of connections that they could correctly be referred to as a single system.
Really could be.
The nervous system senses damage, infectious agents, and foreign bodies with the help of chemical-releasing immune cells, and deals with these problems by deploying different kinds of immune cells to carry out specific procedures.
Battles. We're at war.
So disturbances in our nervous system, which are these subluxations we talked about, can diminish the ability of an individual to sense and repair this damage and combat infection, cancer, or other things like that directly, and that results in diminished health.
We really talk about this with the stress response. So one of the tests that we do, we look at heart rate variability, and we're looking at it to find out if the nervous system is living in a state of stress, right? Defense physiology, dis-ease. Is it tired? Is it on high alert, right? I equate this to driving your car with only the gas pedal, right? And you're going. You're stress. And eventually, you're either going to run out of gas or you're going to run into a tree, right? And then all of a sudden, now you have all these health issues. So that stress diminishes the immune system's ability to respond appropriately to things, which is why stressed people tend to have more colds and flus, more infections.
They can't fight the battles.
They cannot fight the battles. There is no energy to fight the battles. So, when we adjust regularly and then we retest these patients, we find that their nerve system's ability to adapt now goes into health And wellness, no longer stress and defense.
It's very cool.
Is super cool.
And it's measurable.
It is measurable. That's what we love. We love measurable. So, I really want to touch on the danger of antibiotics, right? So, as time goes on, we're learning and I think finding that antibiotics are being less and less prescribed. Mm-hmm. But there was a time when antibiotics were so overprescribed, we started creating these super bugs. And it's so, common that as parents, right, when our children are sick, and we don't know to take them to a chiropractor, we take them to the medical doctor, to the urgent care, and the doctor writes a script for antibiotics, right? Maybe for an ear infection or, something else. And most of the time, these infections are viral. And the antibiotics will do absolutely nothing for, a typical viral infection. It's actually 30% of the time when doctors prescribe antibiotics for kids that they're just not even needed. And that's a stat from the CDC. A recent study from the CDC actually revealed the side effects from the antibiotics, most commonly severe allergic reactions, responsible for more than 65,000 children being rushed to the ER every year.
It's crazy.
For children younger than 5, side effects from antibiotics, such as amoxicillin and zithromycin, are the leading cause of ER visits due to adverse drug effects. So, I don't know about you, but I don't want my kids having an adverse reaction to an antibiotic. I would much rather, get them adjusted, give them, depending on their age, appropriate supplementation. There's different things holistically that we can do, which would include homeopathy or, all sorts of fun things. The overuse of antibiotics, as we know, is contributing to these superbugs. Now we have strains of bacteria in our hospitals that won't respond to antibiotics, right? Mm-hmm. Flesh-eating diseases and all sorts of yucky things like that. Antibiotic resistance occurs when a bacteria really develop the ability to defeat the drugs designed to kill them. And each year, in the United States alone, at least 2 million people are infected with antibiotic-resistant bacteria, and at least 23,000 of them will die as a result. So, if we can avoid 23,000 deaths, I think it's worth, looking at some alternatives. We offer really safe alternative care rather than an overuse of antibiotics. Breaks my heart.
Yeah. The dreaded ear infections. So ear infections are the most common childhood illness, other than colds, for infants and young children. Ear infections occur most frequently between the ages of 3 months to 3 years, but they are common up until the age of 8. Mm-hmm. I know I got them a lot when I was a kid. 5 out of 6 children will have at least one ear infection before their 3rd birthday.
Woohoo!
And nearly 40% of children will have 3 or more ear infections before that age. That's a lot of ear infections.
It is a lot of ear infections.
And we as chiropractors take a holistic and non-toxic approach to treatment, which includes spinal adjustments. Mm-hmm. We address ear infections by adjusting the neck mostly.
Yep.
So the nerves that control the eustachian tube, which is a little tube in our ear, those begin in the upper neck. And restoring that proper nerve supply may help drain the ear. Mm-hmm. So how can you tell if your child has an ear infection? Kids can't always tell us if where they hurt or even if they're hurting.
Right, especially before they're verbal.
Mm-hmm. Yep. So here's some common signs that your child might have an ear infection. If they're tugging or pulling at their ears, just fussiness and crying in general, trouble sleeping, if they have a fever, especially in infants and younger children, fluid draining out of their ears, clumsiness or problems with balance.
Yeah,
because our balance is controlled in our inner ears too. And if they seem like they might have trouble hearing or responding to quiet sounds.
Right, and it's not selective.
Right.
They're in the game and they don't know what's going on, right? So especially here in St. Louis, we know allergies are huge, right? And children suffer the exact same allergy symptoms that adults do. They sneeze, they have itchy, watery eyes, they got stuffy noses. Environmental changes such as air pollution, rising temperatures continue to propel those allergy levels to epidemic proportions with reduced quality of life for them. Lower productivity and, increasing medical costs. I don't know about you, but, drive down Highway 40 on a really hot, hazy day and you've got that little highway sign that says air quality is yellow,
right.
carpool. And thankfully we offer a drug-free holistic approach to taking care of these allergy symptoms, right? So there are 5 most common allergies, which I'm sure everybody in St. Louis knows about: pollen, grass, dust mites, mold, and weeds, right? We've got mold all over the place. So, these allergies, they trigger a release of a substance called histamine. And these histamines trigger an inflammatory response in the body, such as itching, sneezing, even nausea and vomiting. So the study of psychoneuroimmunology, right? That's a huge word. Psychoneuroimmunology explores the relationship between stress and the body's corresponding immune changes, right? So some of the stuff we talked about earlier. So research has found that stress and allergies provoke the similar inflammatory responses. And the stress exacerbates the immune system's already hyperbolic response to allergens, right? And allergies have 2, right? You can get inflammation or you can get congestion, right? And then if you're taking OTC allergy medicine, you need to know which one to take, because if you're, not necessarily gunk in there, but everything's just swollen shut, you don't want a decongestant. You really need that antihistamine. So enough about OTC. How do we help you, right, as chiropractors, right? Because like what Dr. Sarah said, that close relationship between the nervous system and the immune system, improving communication between the brain, spinal cord, and the immune system, adjustments will regulate and control and coordinate that histamine response, right? We will strengthen the immune system and, have, rather than this overwhelming flare-up of red, angry inflammation, right? We might only get some itchy eyes, or, it's a more appropriate response to the environment that's out there. Now, of course, we're also going to make other recommendations, right? About diet, lifestyle changes, stress reduction, right? So parents, if you guys have kids right now with allergy symptoms, eliminate the mucus makers, right? Milk, bananas, grains, right? Until they're clear. And then if you really want healthy kids, come talk to us, because they don't need the milk and the stuff anyway. So, but that's a whole nother discussion. So that's what we're going to do.
All right. So one of the most common reasons that parents seek chiropractic care for their child is a physical trauma from an injury of some sort.
Yes. Oh, you know what? I'm going to interrupt. I apologize. I'm interrupting.
Away.
So 50% of all kids before the first year of life will have a fall from a high place, right? So there's never been a better time to have your child at the chiropractor than, between the day they're born and the first year of life.
Absolutely. So it is important to note that the spinal misalignments that might occur at the time of the injury will not necessarily result in immediate pain or symptoms. So that's just really important to think about. If your kid isn't saying, oh yeah, it hurts, but if they said, I fell down on my back or whatever.
Right. I fell out of the tree, Mom, but I'm fine.
Yeah.
Okay.
Exactly. So being that children's chiropractic care takes a holistic approach, there are some signs that can indicate spinal problems or problems which can be addressed holistically.
When that pain isn't present.
So if you're seeing fatigue, stiffness, flared feet, a difference in weight from side to side when your kid is standing on 2 different scales, and then differences in shoulder, elbow, or hip height when they're standing up, and then a tipped head. Those are all indicators. So a study of athletes by the Journal of Chiropractic Research and Clinical Investigation concluded that athletes who received 12 weeks of chiropractic care exhibited a 30% improvement in reaction time versus a group with no chiropractic care.
Nice. So they ran faster, jumped higher, and performed better.
What else could you want?
What, right? Especially as our young kid athletes.
So here are just a couple statistics here. So the number of kids who play organized sports every year is 36,250,000.
That's a lot of kids.
That's a lot.
We're going to need more chiropractors.
Right. The percentage of parents who are worried about injuries in youth sports is 87%.
I'm surprised it's not higher.
Right. Percentage of kids who play sports outside of school is 60%. Percentage of boys who play organized sports is 66%, and percent of girls who play organized sports is 52%. More than 3.5 million children ages 14 and younger get hurt every year playing sports or participating in recreational activities. And more than 775,000 children ages 14 and younger are treated in hospital emergencies for sports-related injuries every year.
Concussions.
Yeah. Most of these injuries occurred because of falls, being struck by an object, collisions, and overexertion during unorganized or informal sports activities.
I don't know how many times my kids took baseballs to the head. And soccer balls.
Yeah. I once got hit in the back with a golf ball.
Ow!
I didn't go to the ER.
No.
I probably should have gone to the chiropractor.
Yeah. Well, it's okay.
According to the CDC, more than half of all sports injuries are preventable. Overuse injuries are responsible for nearly half of all sports injuries to middle and high school students. And younger athletes are more susceptible to these overuse injuries as they have slower reaction times than adults. They're less coordinated, and they are still growing and developing.
Yeah.
In addition to physical stress, chemicals in our environment can also affect the child's nervous system and could also warrant a spinal checkup.
Yeah.
Regular chiropractic checkups can identify a potential spinal dysfunction resulting from these different kinds of stressors, and chiropractic adjustments can help to enhance future function and well-being.
Absolutely. And, you know, and overuse injuries are really, I see those a lot, you know, not only in the kids, and I know we're talking about kids tonight, but, you know, even people who do repetitive motions at work, you know, our grocery store checkers and factory line workers.
I think we're going to get a little bit more into that, too.
We are, aren't we? So let's really talk specifically about sports injuries, you know, in children. So researchers at Children's Hospital in Philadelphia found that there was a more than 400% jump in knee injuries in young people treated at an urban medical center between 1999 and 2011. Their findings offer really a glimpse at just how kids' legs might be getting hurt when playing sports. You know, and from our perspective, you know, if their hips are out of alignment, their feet are flared, you know, the whole biomechanics of that lower extremity is not working, and they're going to be more prone to injury. The study was presented at the 2011 meeting of the American Academy of Pediatrics in Boston. The number of young people diagnosed with a torn meniscus, also referred as a torn cartilage, increased by an average of 14 injuries per year. And then anterior cruciate ligament, ACL, tears rose by 11 cases per year. My 19-year-old just had his ACL reconstructed at the end of May. Tibial spine fractures, that's your shin bone, had a modest growth of just 1 injury per year. So as chiropractors, you know, we can make these life-changing rehabilitative recommendations, which really help parents manage pain and provide guidance on overuse and the important time out and rest that's needed from sports, and so that, you know, the body can develop and heal properly. You know, additionally, one of the things we really want to look at as parents for our kids is focusing on that single sport. Right? Year-round, they play only one sport. Really significantly increases the number of overuse injuries, right? Soccer, volleyball, basketball, baseball, you know, these students will make a commitment to that single sport at an early age, and it'll lead to overuse injuries, not to mention burnout, right? By the time they get to high school or college, they may not even want to play anymore.
Right. Just think about, like, those single movements in a certain sport that you're just doing all the time, and like that's why baseball players get a lot of shoulder injuries,
right? And Tommy John and all sorts of fun things. So we really encourage parents to if your child is hurt, don't force them to play through the pain. Right? It's not going to do their careers any good to do permanent damage and never be able to play that sport again. Overuse, it can be treated with rest, chiropractic care. Parents, you guys can help manage pain with ice and rest and things like that. So it is 7:00 and I have a call. You're going to finish off, ladies and gentlemen. I'll check in with you just a little bit later.
Hey, Andy.
Okay, where were we here? So like she said, these overuse injuries can be treated with rest and chiropractic care, and we can tell the parents how to help manage the pain that their kids are going through on these overuse injuries. And yeah, all right. A little bit more about sports injuries here. So the main reasons why athletes suffer sports injuries include forceful impacts, repetitive motions, overtraining, and failure to warm up properly. And the two most common techniques to treat sports injuries are going to be spinal adjustments and mobilization. So to perform these spinal adjustments, a chiropractor will place your child in different positions and perform a manual impulse with our hands to an affected joint, and that's going to release pressure in the joint and align the muscles and joints right around that joint so that they work the way that they're supposed to and they get aligned. In some cases, the impulse can cause that audible cracking sound, which we call a cavitation, and that is just the release of gas that happens when the joint opens up and motion is restored there. So we might also incorporate other treatment methods to relieve pain, such as ice, heat, or electric stimulation, the little e-stim pads. And in addition to treating injuries, we also can help prevent injuries from occurring by regular adjustments and offering exercises to correct postural misalignments. Boys are more likely than girls to sustain an injury during sports, and lower extremity injuries are more common overall, so that's going to be your hips, down to your legs, down to your feet. And prior injury is a strong risk factor for future injury. Sports injuries in children are on the rise due to overuse, like we've been saying, and with more intense participation and specialization in sports at very early ages, certain parts of a kid's body become subject to the trauma of overuse. Epidemiological data on sports injuries are provided by several national surveys. Investigators have used different methods to define sports injuries, and the most widely used definition is based on athlete exposure time. Certain aspects related to adolescent growth and development modulate the pattern of these injuries as well. Okay. So just a little bit here about qualifications that chiropractors can go through to become specialists in pediatric chiropractic. After chiropractic care, a chiropractic can go on to get special training and be designated a diplomate in clinical chiropractic pediatrics. So this is going to be 30 modules, which is 360 plus hours taught over a 3-year period. And the curriculum here is structured, and it balances academic knowledge with clinical application. They go through practical workshops, observation and training at a children's center for special needs children. And they have to do research writing and oral presentation, and yeah, cool stuff there. So then there's also the ICPA that we talked about earlier, International Chiropractic Pediatrics Association. And this is a non-profit organization based out of Philadelphia, and it's devoted to the chiropractic care of children. Their diplomate program involves a total of 400 hours of learning, and it's achieved through the successful completion of 2 levels of study there. Okay. All right. that was one of our longer classes, I'd say. And that's all the information that we have for you guys today on the subject of chiropractic for kids. If you guys are interested in the sources that we use to put together this class, just let me know in the comments and we can send those your way. So thank you guys so much just for taking the time to experience our class this evening. We love sharing this topic with people who are eager to transform their family's health. We invite you and your families to come experience firsthand the changes that chiropractic can make in your kid's life here at our office. So like we said tonight, it is so important for developing bodies to stay aligned, to allow for that optimal growth and healthy nervous systems. So give us a call at Get Well Family Chiropractic to schedule a new patient appointment for you and your kids. Our contact information is going to be pulled up here on the next slide. Okay. So if you guys have any more questions or comments, anything like that, just feel free to post those in the comments. If you enjoyed our class tonight and think that some of your friends might gain something from it too, the video will be available here afterwards on our Get Well Family Chiropractic Facebook page. And we also post all of our Facebook Live classes to our YouTube channel, which is Dr. Robin Lawrence. We want as many parents as possible to learn the value of chiropractic for their kids, so let's just share this message and share this video. We will be back next week, same time, same place, next Tuesday, 6:15, for our next Facebook Live class, and that's going to be strengthening your pelvic floor. So head over to our event page for that one and mark going or interested if you think that you might want to join us for that one. So thanks again for joining us tonight, and I hope that everyone has a great week. Good night.